today just because I do want to give a quick overview of what we're planning to do when we start our workshops on Monday. And then I will put on the post-test right after that so that people can do it. And I would encourage everybody to do the post-test right away because I'll probably keep it on for an hour and then take it off. And those who cannot do the post-test for any reason today, I'm going to have a separate post-test for them on Sunday night around the same time, 8 p.m. Sunday. So just want to kind of say that. And let's see who's on the call. First of all, I want to check if everybody can hear me well. Last time there were some audio issues. Can you hear me well? Okay. Don't have a response, but if anybody can just chat it in or.
Yes, we can hear you well.
Okay, great. Thank you. So without much ado, I'm going to get started. Just a quick overview of our program. We're calling it the NNETS program, the Neonatal Essential Training and Skills Program. It is a partnership between Connecticut Children's Center for Global Health here in Hartford, Connecticut, the Miru Foundation, which is a nonprofit that we do. It stands for Medical Education Resources Unlimited. And that's a foundation that's focused on medical education around the world. And then, of course, this cannot be done without the Ministry of Health and in Mauritius, Ministry of Health and Wellness, and their support, because they are providing all the support for travel, accommodation, and everything else for the team that's coming over. So, of course, we are very grateful to the ministry for supporting this program. And as you probably know, this is part 4 of a program that was started by Dr. Arvind Bandhu, who's from Mauritius and works at our center. And Dr. Bandhu is not able to come this time, but he's behind the scenes working on all aspects of this program. So with that, we're going to get to the next slide, which is the sponsors. I mentioned the sponsors already. And the team that's coming over includes me as the team leader, and then Dr. Shilpi Chabra from Seattle Children's Hospital, University of Washington, which is on the west coast of United States. Dr. Rachel Koski, who's from the University of Minnesota, which is right in the middle of the United States. Dr. Sharon Wagner, who's nurse practitioner and doctorate in nurse practitioner from Baylor University, which is the southern part of the United States. And then we have Dr. Kiran More from India, who's joining in. And Kiran More has worked in all places, including Canada, Australia, the Middle East, and now is settled in India. And of course, Dr. Bandhu, who's originally from Mauritius, but works at Connecticut Children's. So that's the team. And this is our schedule. The schedule is packed. And so I'm hoping that as many people as can take the opportunity can come. Hopefully people can come to the same hospitals where they work. But if for some reason they cannot do that, they're welcome to come to the other hospitals if they miss a session, but they have to get the permissions from the local hospitals to make sure they're allowed to come in. And as I said, anybody can join in, whether they're part of the hospitals or not, as long as they're willing to learn. And it doesn't matter what position they have in the hospital, whether they're the chief of the hospital or the newly hired doctor or nurse. Everybody is welcome in the same way. So because the goal is teaching and learning. And just want to reiterate that we have completed the didactic portions, and today, September 4th, we'll have an online test, which I'll put in right after my short presentation. And there'll be 40 questions in that. And again, the responses will be recorded, and you'll get immediate feedback on your responses. And we will keep the responses as a record of, the final completion. And those who cannot take the test today, I understand that, their work and other duties that prevent them from doing it. In that case, for the few people, if they can email or text me their details, I will send them a separate test on Sunday at 8 p.m. And they can, again, take that test within the hour. So that's kind of the plan for the didactic part. And then the workshop part starts on Monday, 8 September. And we will be doing sessions. And since there are team members coming at different times, the initial team is going to be mostly focused on POCUS, which is point of care ultrasound and ventilator workshop, including use of nitric and management of PPHN. Each workshop will be 3 hours long at a particular site, as it indicates here. From 9 to 12 noon, there will be a workshop on POCUS at SAJ Hospital. At the same time, there'll be a workshop on ventilators at Victoria Hospital. So there'll be two teams of two groups from our original team that will be doing simultaneous sessions. And again, anybody who can make it to that session can come in and join in. And as I was saying so far before I started this, I did a quick review of how many people have signed up. And at that time, there were 65 that had signed up, with 40 docs and 25 nurses. There were 22 from SSRN, 15 from SAJ, 10 from G2, and 9 each from JNH and Victoria at that time. There may be more now. But that just gives us a general idea that at each session, there may be about 10 to 20, 25 people. So we will adjust our teaching accordingly, so that we'll be working with small groups so that everybody has an opportunity to participate and ask questions. So the focus will be a very, let me kind of go into each workshop and what it'll cover quickly. So the ventilator workshop would be 3 hours long. The first hour would be just a review of what you guys do for respiratory support. And then we'll give you a workbook in which you can write down your responses. And we'll have a few clinical scenarios, starting from stabilization of a baby at birth, care of a 28-week baby with RDS, and a term baby with the meconium and PPHN. We'll go through the case scenarios, and you can, again, use your workbook to write down your responses and make your notes. And we'll talk a little bit about ventilator complications and extubation strategies on the ventilator. So after the first hour of that, the second hour will be mostly on PPHN and nitric, looking at strategies to prevent PPHN, supportive therapy, nitric oxide, when to start, when to stop, how to monitor, and other drugs that can be used. And we'll talk about ECMO. I know ECMO is not available there, but what would be the scenarios for which you can prepare for? And then the last hour will be a problem solving for local issues and question and answers. So that will be the ventilator session. The POCUS session is going to be very more structured, because we will need a machine to demonstrate that. It's, again, everything is going to be demonstration and hands-on. It's not going to be lectures. There may be a short presentation at the beginning, but most of the would be discussion and hands-on. So everybody will be asked to participate. The ultrasound will be used, if available, at the site to demonstrate on a baby or a volunteer, depending on what's available. And again, just for people who are skeptical about the ultrasound and whether NICU staff can use it or not, the NICU staff can certainly use it as a tool, not as a diagnostic equipment. So just like you use a stethoscope to look for breath sounds, we'd use the ultrasound to look for blood flow or the lung. And so that can be used in that format. Again, you'll not be providing a report or or diagnosis based on that, but just as a clinical tool. So live demo would be done, and people would be allowed to kind of work with the demonstrators on how to use it. And again, this is more advanced, so mostly for the doctors in the group, and also even among them, maybe people who have access to ultrasound machine. And places that don't have access to ultrasound machine can certainly still participate in the theoretical part of it. Maybe in the near future, you will get an ultrasound. Then, but the quality improvement workshops will be actual practical quality improvement project that we will start at that hospital. So it'll be, again, a 3-hour workshop. We will start with how to focus on what problem you want to solve. Maybe we'll do that even earlier before we come to the hospital. And so once we have the problem that you want to solve, we will go through the steps of developing a smart aim and developing measures and how to evaluate data, baseline, as well as collecting data. And we'll develop forms and measures for the QI, which are called process measures, measures of success, and balancing measures. And so the project will be launched after we finish the workshop. You'll be asked to collect data, and in 3 months, you'll be asked to evaluate the data to see what has happened. And people who have successfully completed the 3 months of that QI project and participated in all aspects of it, we'll provide them a certification of QI implementation. Ideally, a full QI would take 2 cycles. So the first cycle will be the first 3 months, and the second cycle will be the next 3 months. And usually, most problems can be solved within that period of time, going through 2 cycles. So we'll do that in the QI workshop. And in the NRP program, which is, again, a 3-hour program for doctors, because we'll be using medications and intubations and stuff like that. So we'll use the 8th edition of the neonatal resuscitation program, which is currently in use in the United States and other countries. And we'll go through the 4 major strategies on that: the initial steps, airway management, chest compressions, and use of lines and medications. And at the end of the course, people would be asked to demonstrate the whole skills in a group. And people who completed with a short knowledge exam as well, they'll be provided a certificate for NRP course completion. And then the ENC program, which stands for Essential Newborn Care, basically it's a Helping Babies Breathe program that was initially started by the Academy of Pediatrics in the United States, and then was adopted by the WHO as a ENC1. So it's Essential Newborn Care Part 1, which is dealing with resuscitation at birth. It's a 3-hour hands-on module, but then followed by actually another 3 hours of demonstrations and OSCE. So basically, it's almost a whole day program. But we'll try to finish it as quickly as possible. And then at the end of the program, each individual will be tested on all the steps by a OSCE test, and then we'll provide the certification for ENC completion at the end of the course. This is mostly for nurses, but other junior doctors, others are welcome to take it if they want. So we have a doctor's curriculum, which basically would be ventilators, POCUS, NRP, and QI, and the nurses curriculum, which we mostly focused on QI, ENC, and ventilators, but everybody is open to join any session. There's no restriction. And then, of course, I talked about certifications. So people who complete the initial portion that we did didactic, as well as any of the specific modules, either ventilator, QI, or a ventilator or POCUS, will get attestation of completion of the NNETS program. People who do QI will get a separate certification. People who do NRP will get a separate certification, and ENC will get a separate certification. So that's kind of the overview, and I don't want to take too much time on this part, because I do want to have a few minutes for question and answers, and I will put in the post-test right away. So feel free to ask questions, because it's a different kind of arrangement, and people may not be totally clear on what we're talking about, and this is a good time to kind of bring up the question. You can either chat the questions or unmute your mic and ask the questions. Is everything that clear that nobody has any questions? That's quite amazing. Okay, so if there are no questions, I will go ahead and put up the post test. And the post test is, again, you have to fill in your name and hospital affiliation and role. And then there are 40 questions. Each one has only one correct answer. So you can, again, do it at your time for the next 1 hour. After that, I mean, when you do the responses, it comes as a timestamp, so I know exactly when it was completed. So I will keep it open for a couple of hours if people want to finish it off. And then after like maybe 1.5 to 2 hours, I will take it off from the website, from the WhatsApp. And if anybody is having any trouble with the test, just you can text and I will reply. All right, so I'm going to put it on now, just in a second. The NRP session is only for doctors. That was a question. Yes, it is only for doctors. Nurses can come if they want to. It's just it's going to be a repetition because ENC is the part that the nurses would do anyway. But if they want to come and observe, that's fine. Or if they want to participate also, that's fine. I'm not going to stop anybody from learning anything that they want to learn because, learning is always good. The only thing is if there are too many people, we may have to say, okay, we're going to restrict. But ordinarily in a session, we can accommodate at least 15 people in 3 groups. So there'll be 5, 5, and 5 in each group, and they will keep rotating on the station. So unless there are more than 15 people, anybody is welcome to take part. So, okay, I'm going to put this on now. I think you should be able to see it in a second. It's called post test for didactic session. And I think it's on the site now. And if you have having any problem on the WhatsApp or any other problem with the test, just text me. And if everybody is fine, I'm going to log off, and you can do the test at your leisure, as I said, for the next 1.5 hours or so, and then I'll take it off. All right, everybody okay with this? Are you seeing the test on your WhatsApp? All right, looks like I'm getting a few thumbs up, so that's great. So I'm going to then stop this meeting, stop this Zoom meeting, and then you can go ahead and do the test. Thank you, everybody. Looking forward to seeing you all. Actually, Dr. Chabra from our team is landing there tomorrow morning, or the September 5th morning. And she will be at the Suffern Hotel and Resort, I think. That's where we are launched, I believe. Help her out if she needs any help. We'll be arriving, the rest of the team will be arriving on Sunday morning, the 7th of September, and a couple of the people are arriving on the 8th and 11th. So the whole team will be there by the 10th or 11th, but most of us will be there by Sunday. So hope to see you in Mauritius, and good luck with everything. Thank you.